Good evening, everyone. And likewise with Satori, I also have a dog who loves to distract me during whenever I'm presenting. So please, again, forgive the noise if there is any background noise while I'm presenting. Well, welcome everyone on this rainy, stormy, cold night. I'm sure you guys would rather be outside right now, but we're going to just talk a little bit about common injuries and illnesses that you might see at an MRC special event. And so I am going to go quickly over the MRC scope of practice. Usually whenever you guys are at a deployment, I will go over the scope of practice before you get started, just as a reminder, so you don't have any issues or there's no gray area when you're actually participating in your deployment. And then I'm going to go over some common injuries and illnesses at marathon events that you may see. Most common illnesses and injuries that are seen at festivals, and then any recommended certifications and trainings. And then I'll also open the floor for questions. But this presentation is very informal, and so please feel free to use the chat as I'm going through. And I'm pretty sure Satori will probably manage that while I'm presenting. And then also, I will welcome any questions or comments at the end of the presentation. All right. So the MRC scope of practice, essentially, let me see if I can click on it, see if this link actually works. Are you all able to see this on the screen?
No, I think you'd have to share a separate screen.
Okay. Well, we don't have to go through all that. But essentially, we do understand that many of our MRC volunteers come from varying professional backgrounds, hold various levels of degrees, certifications, licensures, but it's really important that we do function under the scope of practice that's outlined for MRC, just so because we're working under another physician's license, and we don't want to have any liabilities on our hand while we're out. So essentially, we just require that all MRC volunteers that are fall under the clinical volunteer are able to recognize medical emergencies and alert 911, be able to provide basic life support, assess vital signs, so the blood pressure, heart rate, oxygen saturation and temperature, administer IM or subcutaneous injections, and I should probably update that now because we're also doing intradermal injections in case one of you are deployed to a monkeypox vaccine clinic, administer or dispense oral medications according to PDPH medical standing orders during a mass prophylaxis response, distribute and administer any other medications that are deemed available or that is written by a PDPH physician during a mass care event, perform initial assessments and alert EMS or partnering agencies of anything that's pertaining to neurological functioning, external body conditions or injuries, physical complaints or concerns. Also, clinical documentation is important. And then we also hope that you are able to lift over 50 pounds. But if you are not, you can always let us know and we'll place you accordingly during the deployment. But it's also really important that typically at these MRC special events, we don't allow people to initiate IVs. You are able to, of course, get the bag started, get the line started, but the tubing started rather, but we do not, we prefer that you guys do not initiate IVs unless there is a mass surge in an event. So say, God forbid there's a mass casualties or injuries that are occurring outside of our tent, and it requires a lot of people to seek help. We will then allow you guys to start initiating IVs and doing the more higher level skills. So if it's unavoidable, you are able to do that. You're also exempt from performing invasive medical procedures or interventions while assisting in a deployment, and all MRC volunteers are only permitted to perform duties that are within their licensure and their scope of practice. And if any of that is deviated, you'll be removed from MRC permanently. With that saying all that, there could be a time in where MRC might require a little bit more, especially of our physicians. So again, if it falls under your scope of practice and your licensure, you will be able to perform those duties, but you should only do so under the direct supervision of an MRC or of a Philadelphia Department of Public Health physician. Okay. Are there any questions about that? I don't know if I'm able to see the chat, but it doesn't
There's
look
nothing
like
in the chat right now.
Okay, perfect. So just let me know if there are any questions later on in the presentation. So during our marathons, we might see injuries that are related to heat, cold, and exercise-related illnesses. And the list of what we're going to go through is on this slide. There might be some minor injuries like cuts, grazes, and blisters, which this weekend, if you're deployed, if they put that little speed bump at the end of the race, we'll probably see a lot of those. Joint and bone injuries, so there's sprains, joint pain, shin splints, fractures we could possibly see, muscle tears, or muscle injuries, and then cardiac and respiratory emergencies. And I did add some things to the presentation. If you've seen this before, I added information about hypothermia and frostbite, and then under the cardiac and respiratory emergencies, I added like crushing injuries and panic attacks. Okay. So heat, working in the summer, we probably won't see this, you know, in these next colder months, but sunburn sunburn and heat rash are definitely a concern for us. And so sunburn especially does draw fluid to the surface of the skin and away from the body. And severe sunburns can cause a person to become dehydrated, even go into shock. And this might look like low blood pressure or profound weakness. And so if you are on a deployment and you think that someone might be experiencing shock due to sunburn, it's important that you notify the medical staff immediately or the EMS that are in the tent. And also, you can also, of course, assist in starting their vitals and getting them some help. If you do notice someone comes to you at the end of their race and they do have heat rash, you can, if they would like, they can be assessed, but essentially it's important that they stay in a cool, dry place, keep the rash dry, and use some powders when they get home that can soothe the rash. So if someone does have minor sunburn, you can instruct them to stay out of the sun until their sunburn heals, put cool cloths on the sunburn areas, or take a cool bath, put moisturizing lotion on the sunburn areas, but it's really essential that people don't break their blisters. I mean, I think all of us can attest to that. Can be kind of relieving to break the blister, but that can introduce infection into the skin and make things a bit more complicated. So just make sure you remind people to do not break those blisters. Heat cramps are very, very common whenever we're at the marathon events, and is characterized by heavy sweating during intense exercise that leads to muscle pain or spasms. And these spasms can, they're extremely painful for the runners, and they'll have to come into the medical tent immediately. So if someone does have heat cramps, or you see a runner complaining of heat cramps in the middle of a race, you can instruct them to stop the physical activity and move to a cool place. It's important that they drink water or a sports drink. And in our med tents, we usually have some soup that's available. So if you do see that, like one is coffee, one soup, make sure you don't get the soup because it'll be really gross. And then make sure that they wait for the cramps to go away before they do any more physical activity. But it's really essential. And then typically people will get help before they reach this point, but cramps that last longer than an hour, someone should seek medical attention right away. If someone expresses that they're on a low sodium diet, they should also be seen immediately. And if they express that they do have a history of heart problems. MRC volunteers may lead the affected individual to a treatment area and provide water or sports drinks. Heat exhaustion looks like heavy sweating, cold, pale, clammy skin, fast, weak pulses, nausea or vomiting, muscle cramps, tiredness or weakness, dizziness, headache, fainting, or passing out. And so it's essential that someone who might be experiencing heat exhaustion move to a cool place. It's important to loosen their clothing or have them loosen their clothing, put cool, wet cloths over their bodies, or they might have the ability to take a cool bath and sip some water. And so they should seek medical attention right away, or you should make sure that you notify someone right away. If you notice that they are throwing up, symptoms are getting worse, or those symptoms of heat exhaustion are lasting longer than an hour, because that may be indicative that it's more on the edge of heat stroke. Okay. If any of the listed symptoms, or the symptoms I already gave, if you do observe them, MRC volunteers must notify the available medical team and lead that affected individual to the treatment area immediately. And once the patient is seated, volunteers can also assist the runners in raising their legs of their head and take vital signs, grab sports drinks or soup, and if requested, you can retrieve IV fluid and tubing. The raising the feet above the level of the head is extreme. It's a really easy way to assist someone who is who might be on the teetering between heat exhaustion and heat stroke, and it's a fast, quick intervention that can really save someone's life. And so heat stroke is a high body temperature, so it's 103 degrees Fahrenheit or higher. And it looks like hot, red, dry, or damp skin, fast, strong pulses, headache, dizziness, nausea, confusion, or losing consciousness or passing out. So if you do notice someone could potentially be experiencing heat stroke, you must notify the EMS on site or the medical team on site immediately, because this is a medical emergency. We want to move the person to a cooler place, but inside the med tents, we do have ice baths that would be available. And essentially, they would dunk the person in the ice bath just to bring that body temperature down as fast as possible. But don't juice that unless the physician orders that, okay? Or the medical team on site says that's what you should do. And don't give the person anything to drink, because if they're confused or they're losing consciousness or passing out, that could cause them to aspirate, and then that could further complicate this problem, okay? So again, you guys must notify EMS or the medical team on site and lead the affected individual to a treatment area. So that quick intervention again that I explained, it directs the blood to essential organs if you just raise their legs up above their head, and it will help them immensely. So hypothermia this weekend, I don't think it's supposed to be extremely cold. I think last year, Satori said it was snowing. So hopefully that doesn't happen this weekend. But hypothermia is caused by prolonged exposure to cold temperatures. And these temperatures hypothermia can even ensue if the outside temperature is above 40 degrees Fahrenheit. So essentially, we're gonna have runners that their bodies are soaked with sweat, and they're gonna be running in the cold, and so that sweat-soaked clothing that they have on can really aid in lowering their body temperature, and so that can cause someone to experience hypothermia. And so a body temperature that's too low can affect one's brain and make it really difficult for them to think clearly, and can impair their judgment. And so that person might not realize that they're actually in trouble and need to seek help. And the people that are at highest risk, or one of the groups of people that are highest risk of experiencing hypothermia, are people who remain outdoors for long periods of time. So the people that will be essentially participating in the Philadelphia Marathon this weekend. And so signs and symptoms of hypothermia look like shivering, a body temperature that's below 95 degrees Fahrenheit, exhaustion or feeling very tired, confusion, fumbling hands, memory loss, slurred speech, drowsiness. And so if you do notice that someone could potentially be experiencing hypothermia, it's essential that you alert medical personnel or EMS as soon as possible. Get them to a warm shelter, so the med tent, removing that wet clothing that could be making them, that could be lowering their body temperature. Warm the centers of the person's body. So that would be their chest, neck, head, groin, and use the materials that are available. There could be varying, I'm not really sure what they're going to have in the tent, but they might have maybe warm packs or maybe a heated blanket or something that we'll be able to cover people's bodies to help warm them up. You can provide a warm drink, but not, of course, not to an unconscious person, because that could cause them to aspirate. And then, so in cases of hypothermia and severe hypothermia, some people's heart may stop, and so performing CPR if needed, and of course if you're certified. And then frostbite. So if you look at the picture that's on the right-hand side, this is a good picture of what frostbite could look like. And the reason why they have blisters is probably because this frostbite has started to heal a bit. They've already warmed up their feet, and now they're starting the healing process. And so symptoms might include, and frostbite is caused by extreme exposure or prolonged exposure to cold temperatures or freezing temperatures. And it might look like loss of feeling and color in the affected area. So common affected areas typically are the nose, the ears, cheeks, chin, finger, and toes. It kind of appears like a white, grayish, yellow, purplish, brown, or ashen skin area. And skin usually feels unusually firm, or may even look waxy, kind of like the toes do in this picture. And people will also complain of numbness. And if it's not treated, frostbite can actually lead to amputation of the affected body parts. Okay. And so if you do notice that someone might have frostbite, it's essential, of course, to get the person to a warm area as soon as possible and alert medical staff as soon as possible. So unless absolutely necessary, though, it's really important that the person does not walk on their feet or toes if they're showing signs in those areas of frostbite, because if they walk on those injured areas, it can increase the damage. And so it's also important not to rub the frostbitten areas or massage it at all, because that can also increase damage. If warm water is unavailable, someone, if they have frostbite on their fingers, for example, they may be able to use their own body heat as a means of warming up their fingers by placing them under their armpits. But it's essential that someone does not use a heating pad, heat lamp, or heater for warming the body or the affected areas, because those frostbitten areas are typically numb and they can burn easily. And so also, it's really essential that if you notice someone has frostbite, that to also maybe do a quick assessment, see if the person's hypothermic. Okay? Just keeping that in mind can really save a life and a limb. And so now we're going to go on to illnesses and injuries that we might see at festivals, but I'm going to take a moment to see if there are any questions that anyone might have.
No questions in the chat so far.
All right. So we'll keep going. So these are the minor injuries that we'll probably see. And so they kind of look like the cuts, scrapes, and grazes. So of course, if you do notice anyone with those, you can perform hand hygiene and put some gloves on. You can rinse the abrasion with some cool, clean water to remove the dirt and debris. And usually the EMS or PFD will keep some like saline on them, or some type of like, yes, so something to wash the skin away in this big box that sits outside of the tent. They typically won't bring people into the med tent if they do have cuts, scrapes, and grazes, because it's not something that requires too much attention. You can also use peroxide. Well, using peroxide, iodine or rubbing alcohol is not really necessary, and it can actually cause a bit more discomfort to the area. And maybe the peroxide, if it's serious enough, or it's essential enough, they can use peroxide when they're recovering, or they need to put other ointments on the area, but maybe at that point in time, it might not be necessary to use peroxide. But the saline spray should work sufficiently. You should also stop. It's important to stop the bleeding, so you can gently apply pressure to the area, and using a clean cloth or gauze, and then cover the wound with a sterile bandage or gauze pad and some tape. And if available, some antibiotic ointment can be applied to the skin prior to placing the bandage or dressing. Okay, and then all that stuff should be available and easily accessible outside of the tent in a big bin that EMS has. So then there's blisters. You know, our runners are running for miles, and a lot of people do come off the race with blisters on their heels. So again, these people you can totally help. Perform hand hygiene, of course, put gloves on, wash the area gently with some mild soap. You can apply the antibacterial cream or ointment if available. Cover the blisters with a bandage or gauze and instruct the patient, again, to not pop or break or peel off the skin from the blister because we don't want to introduce infection. And if available, you can refer the patient to the podiatry treat. Blah, 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 blah. I cannot speak tonight. You can refer them to the podiatry team or the necessary medical team for further advice. Okay. So we might see some musculoskeletal injuries. And so as the MRC volunteer, there's probably not so much that we can do for patients if they do come with us. And if it's something that's significant enough, they might have to go with EMS or might be referred to elsewhere, after the race. But what we can instruct them is maybe after the race, some treatment modalities that would be really, paramount to their recovery. So RICE is a great one. Rest, R's is for rest, I, ice, C, compression, E, and elevation. Okay. And then, so there's shin splints. Shin splints develop post-physical activity and are typically associated with runners. And it looks like pain along the inner edge of the tibia. And the treatment is usually rest, ice, and then some stretching. And you can instruct the patient to seek medical attention if the pain is localized, if pain is worse in the evening, or the area of the pain is increasing. Okay. If there's any joint pain that can typically happen, and it's a normal occurrence after exercise, so it may be like pain, stiffness, and swelling. And so that RICE is recommended, that rest, ice, compression, elevation is recommended. And the patient should be instructed to see a doctor, though, if there's any pain, sharp pain, stabbing, or consistent pain that causes a limp, pain that lasts more than 2 hours after exercise or worsens at night, pain or swelling that does not improve with rest, medication, hot or cold packs, and then the area of swelling increases, or the joint feels hot, or the joint appears red. That may be that's definitely an indication that someone should see a doctor about that. So injuries that volunteers may see but falls outside of the MRC scope of practice are those sprains, fractures, muscle strains, and muscle tears. MRC volunteers can, of course, escort patients to the appropriate medical team on site, but for these people, there's really not much that we can do right then and there, and that falls within the scope of practice. Okay, so any questions thus far? Oh man. All right, so no, it doesn't look like it. So we'll just move on to cardiac and respiratory emergencies. All right, so one of the respiratory emergencies we may see are like asthma exacerbations. And this may be something that we even see during a concert because, we saw a lot of this past year. Hi, Charito. So Charito was with me in the med tent. We saw a lot of people with asthma attacks, and so it looks like wheezing, coughing, and chest tightness becomes severe and consistent. being too breathless to speak, breathing faster, fast heartbeat, drowsiness, confusion, exhaustion, or dizziness, blue lips or fingers, and fainting. And this, of course, can come when, especially when we're at these special events like concerts, when they're using fire, smoke machines, and you may see a lot of asthma exacerbations. And this will be something that someone would go into the medical tent for, so they could be evaluated further. If you do witness a medical or respiratory emergency, an MRC volunteer should, of course, immediately notify the medical personnel in the tent. Keep the person sitting straight up and try and keep them calm. And you should instruct the person to use an inhaler if it's available. Okay, but keeping them calm is really essential, and it really does help a lot with having those people kind of center themselves a bit more in the moment, and maybe it might not be an asthma attack and it's more looking like a panic attack. Okay. So then there's, of course, the risk of cardiac emergencies like a heart attack. In any facet of life, someone could potentially have a heart attack, but especially when we're at these marathons and special events like the festivals or parades. And so heart attacks, they look like mild to severe chest pain, and pain that radiates to the arm, shoulder, neck, jaw, back towards the waist. Shortness of breath, nausea or stomach discomfort, heart palpitations, anxiety, so that feeling of impending doom that we all learned in school, sweating, lightheaded, dizziness, or passing out. And so if an MRC volunteer does notice that someone may be experiencing a heart attack, they should immediately notify medical personnel, try and keep them calm. And if the person becomes unconscious and unresponsive, if you've already notified EMS, you should assess their airway, check for a pulse, and if necessary, start CPR. So then there's also the risk for sudden cardiac arrest. And so signs and symptoms about kind of looks like a sudden collapse where someone, there's no pulse, there's no breathing, there's a loss of consciousness. And so some of the signs and symptoms leading to cardiac arrest might be chest discomfort, shortness of breath, weakness, fast beating, fluttering, or pounding heart or palpitations. And so the MRC volunteer should, of course, immediately notify medical personnel or EMS on site. And if you've already notified EMS, assess the airway, check for a pulse, and if necessary, start CPR. And in most cases, if it's sudden cardiac arrest, you should start CPR immediately. So then there's compressive or static asphyxia. Satori and I were working on that word today. We've kind of seen this in a recent, this past year at the Astro World Festival, I believe it was, where there are casualties due to compressive asphyxia. And we also saw people who may have started to experience this compressive asphyxia this summer when we were at Made in America. And so it happens when the body is deprived of oxygen because of external forces are limiting one's ability to expand their chest sufficiently. So typically, if this does occur, the people that are like highest risk, at least that we saw this summer, were those that were closest to the stage, because people from the back are pushing forward. And so festival goers, if the EMS and security notices that someone might be being crushed by the crowd, they will be removed from the crowd. And then they'll assess their needs kind of on their way to the medical tent. A lot of the time, we saw people that were kind of experiencing a panic attack because they were being crushed. And so we kind of gave them a moment outside of the tent to sit, breathe, slow their breathing. And then once they felt better, they were able to leave. But in severe cases, CPR may be necessary if someone is removed from the crowd without a pulse. Okay. And then panic attacks. Again, this was very common this past summer. A lot of people were having panic attacks because of the sheer force of the crowd. Plus, they there was a lot of smoke and a lot of fire. It was hot. People also weren't using the bathroom, so there's probably some dehydration in there too. But some symptoms of the panic attacks might look like headache, nausea, rapid heart rate, dizziness, unsteadiness, lightheadedness or fainting, sweating, tightness in the chest and throat, fear, shortness of breath, shaking, numbness, or paresthesia. And so an MRC volunteer can assist this person with deep breathing. And I really love to count and have the person count out loud, especially if you like have them place their hand on their stomach. And when they're inhaling and exhaling, they'll be able to kind of focus on their hand moving up and down while you count. Hydration is also essential, so you can pass them a bottle of water, a cold compress, and if someone expresses that they do have a history of asthma, they will probably be taken into the tent for further assessment. Okay. And so last time I gave this presentation, these videos, you guys couldn't hear them, but you will have access to the to this presentation. So I would encourage you to view these videos on your own accord, on your own time. So of course, when we're at varying events, there may be the need for administering Narcan. Narcan we'll have the nasal spray on hand, but it can also be given IM and IV, but we have the nasal spray. So please watch that video so you can see how and what interval you should administer Narcan. Oh. So then I would also implore you that if you have not, if you're not sure if you're up to date on your CPR, or if you need to be you need to be recertified, to please go get that certification, because adult CPR and child CPR is extremely important when we're out at these MRC special events. And then there's Stop the Bleed. MRC has a Stop the Bleed training. I think we've had one this year, and I'm not sure when the next one will be, but the Stop the Bleed training is so important because by small interventions, you can really save a life. And so please go ahead, please review this video. And then the next time that we do have a Stop the Bleed training, please come and join us so you can, you know, get that training so you can be able to save a life on the whim. All right, so when in doubt, whenever you're at a MRC special event, always consult the PDPH medical ops lead, which would usually be me, the MRC volunteer lead. So we have Marlon, that's always with us. There's always Julie and Sue that are also MRC faithfuls, so they will probably also be MRC volunteer leads. And then there's the on-site medical team. So there's EMS, and it may be Penn or Jefferson, depending on who's partnering for the event, but please consult with them too whenever there's a doubt. All right, any questions? Oh, stop it. Someone asked in the chat, how do we access the Stop the Bleed video? Satori is going to send the information about the next training soon, and then you guys will have access to these slides. So when I'm just going to try and go back. When you click on the slide, it should play for you. So you just have to press the red square in the middle. All right, well, I'm going to stay on the call and see if there are any questions that do come through, but I'm going to pass the mic to Satori so she can talk to you guys about this weekend's deployment.
Thank you, Cydni. And just to address the question in the chat, so the Stop the Bleed trainings are in person. Unfortunately, that's not something that we're able to record unlike this video here. Our Stop the Bleed trainings are very hands-on. So there is like a formal training that's provided to you. And then we do a hands-on portion where you have like a bunch of different limbs and everything that you're practicing on with like tourniquets and gauze and things like that. So that is coming very, very soon. I will also be sending out, as part of our winter newsletter, I'll be sending out a bunch of trainings and upcoming events that everyone will be able to attend. But we are planning to do, as of right now, our next Stop the Bleed training will be December 10th, which is a Saturday, and it'll be held at our office building in Center City. Once I have those details determined and everything is in place, I will, of course, send out messaging to all the volunteers that you can sign up. Given that we will be having it in our office building, although the training room is relatively a good amount of space, it will be a limited training. So again, I'll put out the messaging. I'll let you guys know ahead of time, you know, that I'll be sending that out. And if you could just sign up as soon as possible, that'd be great. If for whatever reason that you signed up and you don't hear back from me directly or immediately, you can always feel free to text me or give me a call. I will give you my personal cell phone number. I'll put that in the chat actually right now, just in case if you guys ever need it, you'll have it so that you can contact me. And that's for anything regarding MRC. All right. And so now I'm going to see if we can do a seamless switch over, and I'm going to see if I can share my screen. Okay, is everyone able to see this? Yeah, okay, awesome. All right, so I'm gonna go ahead and minimize the screen, perfect. All right, so this is the informational portion of this training for the Philadelphia Marathon. Again, everyone's able to view this portion of the training. I will link this informational and training session on our MRC YouTube page so that you will always have access to it. We're just going to go through some of the important information that you will need to know if you are planning or have been selected to deploy rather for the 2022 Philadelphia Marathon. All right, so let's talk about it. We're going to go over a few different things. We're going to talk about arrival time, meeting locations, check-in. I'm going to talk a little bit more about driving directions, how to get there, what it's going to look like once you arrive, parking vouchers for those of you who will need those. I'm then going to move into just-in-time training, scope of practice. I'm not going to spend too much time talking about the scope of practice only because Cydni did a great job kind of covering that. And as our medical lead, I will defer to her on exactly what that means. But if you do have any questions about the scope of practice at any point, if we didn't clarify anything for you in greater detail, please let us know. Again, you can always contact me and we'll be happy to clarify any confusion that you may have. But it's pretty straightforward, and I'll talk a little bit about that later on. And then I'll move into talking about event credentials and your volunteer roles and responsibilities for this marathon. And then finally, we'll talk about checking out at the end of the deployment. And again, if you have any questions, please dump them in the chat and I will answer all the questions at the end. All right, so for arrival time, meeting location, and check-in, here you have both of the shifts. So if you're deploying on Saturday, November 19th, arrival time for everyone is the same regardless of the day. So for Saturday or Sunday, everyone is expected to be on site at 5:30 a.m. It is an early deployment. I do apologize. That was, what was asked of us, and we try to help out as best as we can. The reason for the early arrival time is because there's a lot of different moving parts. The morning can be very chaotic. Everyone who's working the event is trying to get there. All the runners are trying to get there so they can get set up and get ready. So it can be a little chaotic. So I just want to stress that if you can get there around 5:30, anywhere between 5:30 and 6 a.m., you'll be golden, but no later than 6:15. And I say that because if you are parking or even trying to walk, it may become very, very difficult. The police department is very good about putting up their blockades. There's a lot of streets that'll be blocked off for foot traffic and for vehicles as well. So please make sure that you arrive on time. Specifically for the parking garage, if you plan on parking in that garage, you have to be there before 6:15 because the police will not let you in after the fact, because that road leading into the parking garage will be shut down for the runner. So again, that's why the arrival time is being stressed so much, because it's very important that we're all on time for this specific deployment, as well as every other deployment, but especially for this one. I don't want anyone stuck or stranded or straggling anywhere, so please just make sure on time. If you are running late, please let your MRC point of contact know. It will be Molly Mattis. I put her name and her telephone number down below. Please text her before calling. The day of the event could be very chaotic. Other volunteers may be trying to call her. She's probably trying to call them back or whatever. So it's probably easiest if you text her first, and you can also try calling, but I would definitely start off with a text. In terms of meeting location, so excuse me, in your deployment summaries that you received, everyone is meeting at the same location. So if you are driving and if you are parking in the parking garage, you will meet in the garage. You can contact Molly as soon as you get there. She'll let you know where exactly she is in the garage. There is only one elevator in that garage, so that's why I said, regardless if you're driving or if you're walking or biking, whatever you're doing, meet at the parking garage elevators. You can let Molly know, or even Cydni, if you see her floating around, she'll be there as well, what floor you're on. I would prefer if everybody can meet at the top floor, which is like ground level for the parking garage, just so everyone is meeting in a centralized location and no one's running around. But that is where you will meet. I also, like I said, I linked that in the deployment summary for you guys to have that direct address for directions. If you get lost or turned around the day of, if you're driving, if you're walking, just if you see a police officer or if you see an EMS or fire department personnel, just let them know that you are an MRC volunteer, that you're here to work in the medical tent, and they should direct you accordingly. But again, I did list Molly's number, so you have her contact as well if you need to check in with her or locate her when you arrive. And regardless of, like I said, whether you're parking or driving or walking, biking, whatever, everyone has to check in with Molly. She is your keeper for the day. She's responsible for you guys. So please make sure you are checked in with her. And then, of course, you know, if you've done deployments before, you have to sign in for accountability purposes and liability reasons. She'll have those sign-in sheets for you as well on site. And if you are a brand new volunteer, welcome. We're very excited to have you this year. These are very, they're fun deployments. There's a lot to do. Sometimes towards the end of the race when the volunteers are coming through, that's when you'll see a lot of action. So it's a great day to kind of go out, volunteer, meet some new people, and just, you know, be a volunteer. I mean, I really can't express enough how essential you guys are in these operations. The medical tent would not run without us. I'm going to toot our own horn for a bit there. We are a very essential part of the operation. And so your volunteerism is greatly appreciated. And, you know, if you could just be on time, arrive, check in with Molly, that'll cover all those bases. All right, so driving directions and parking passes or parking vouchers for this one. So again, like I said, I linked the exact address for the directions that you will need for this deployment in your deployment summary. So please follow that. And then for parking passes or vouchers, once you arrive, if you had parked in that parking garage, you'll come in, you'll get a little ticket, like a parking ticket. And once you check in with Molly, let her know that you need a parking pass or parking voucher, and she'll give it to you. They're little stickers. They look like barcodes. They'll go either in the middle or the bottom of your ticket, wherever it tells you to place it. And then when you leave the deployment, when you leave that the garage and you exit, you'll scan it and it'll let you go. So nobody has to pay anything. It's completely free and taken care of for you by the Department of Public Health or by the City of Philadelphia. Just, you know, as another thank you and give back to you for coming out for us for this day or for these days for the deployment. If you don't need a parking pass, don't worry about it. You'll still be meeting in the parking garage with Molly and Cydni. But if you do need that parking pass, you have to let them know once you sign in. It's very hectic and it's difficult to kind of get parking passes and stickers to other volunteers during the deployment or while the deployment is still ongoing, especially at the end, because people are leaving, there's still runners finishing the marathon. So just again, please try to be mindful about that, and please let Molly know if you in fact do need a parking pass. All right, credentials and volunteer roles. So event passes will be provided to you upon check-in, if not at the security checkpoint once you guys get inside the event. They're little badges. This is an example from Made in America. They kind of look like this, but not exactly. They're going to say the Philadelphia Marathon on it with the date on it. They will say medical on it as well, just to help better identify volunteers and other clinicians and other non-clinical volunteers who will be at the site. You will all be working in one medical tent. There may be a secondary tent location. If asked to support that tent, Cydni will be the designated point of contact. So if anybody comes up to you and says like, hey, we really could use you as a secondary tent, please check in with Cydni first. Do not veer off or go off with anyone else, whether they're EMS or fire, whoever, without checking in with Cydni and letting Molly know. If you are a clinician, that secondary tent is typically for clinicians. They sometimes need extra hands on set. So they may ask for that, but again, go to Cydni, make sure it's okay, and she'll decide who's going to that secondary tent, and she'll determine that based off of need, patient volume in the tent, and other factors such as those. Okay, I did cover shifts, but I just wanted to put it here just to reiterate that for everybody. So for Saturday, if you're deploying on Saturday, 5:30 to 1 p.m. I know that the deployment summary said prepare to be on site until 3 p.m., but historically, as I've worked these events, they typically wrap up around noon, if not 12, or if not 1 at the latest on Saturday for the half marathon. And then on Sunday, 5:30 to 2 p.m. will be your shift time. Again, prepare to be on site until 3 p.m., but that has not been asked of us in years past, so I wouldn't worry too much about that. If for whatever reason, because I do understand it could be chilly, years past, it has snowed, it has been 30 degrees. So if you become, cold or really tired, if you're cramping, or if you're experiencing physical discomfort, please let Cydni or Molly know. If you feel like you need to go home, or if you can no longer complete the deployment, please let them know. But do not leave without checking it out with one of them first. Of course, if there's a family emergency or some other emergent situation that pops up or appears the day of the deployment, and if you have to leave, we completely understand. We just ask for transparency and communication. For breaks, there's no official designated breaks because essentially when the marathon starts, all the runners begin running. There is some time before you really see that first person come through. So that'll be your unofficial break to grab coffee, drinks, whatever, food, refreshments. EMS and the fire department are really great, and they're very gracious with providing breakfast for us. So in years past, we've had basic breakfast buffets like bagels, muffins, things like that. I would suggest bringing something warm to sip on. I would not suggest drinking the broth that they have in the tent for the runners. You do not want that, trust me. But the only other beverage they provide is water for staff. So just please make sure you're bringing any beverages, any snacks, any food, anything that you would need, any items of refreshment. Bring it to the deployment just so you have yourself taken care of and situated in the off chance that nothing is provided to you. Though I have been told, and again in years past, they do provide breakfast for you guys. So that should be taken care of. If you need to use the restroom or step away, or if you have an emergent phone call, anything like that, I know I have a lot of clinicians on the call. So if duty calls, if you guys need to step away, we completely understand. Again, you are volunteering your time for us, so we're already grateful. But again, I do just want to stress that you are to check out or let Cydni or Molly know that that is what you're doing, just for accountability purposes, so they know where everyone is. And in the off chance that there is an emergency situation, they should give a just-in-time training the day of your deployment, letting you know wherever the rally points will be. That should be identified for you. All right, so when your shift is over, you can check out with either with the tent lead or with Molly. You can text her if you don't see her, just say, hey, like I'm heading out, my shift is over. Please do not leave without checking out. Again, I cannot stress liability and accountability enough. It's very, very important for us to know exactly where everyone is, for your safety, for everyone's safety. Really, this is a large event. We will have thousands of people here. The amount of runners that are there, family, friends cheering them on the sidelines, the amount of police personnel, EMS, it can become very chaotic, and we want to make sure everyone is safe and accounted for. So again, please just check out with Molly or Cydni. If you see them, let them know like, hey, I'm heading out, and you can wrap up your deployment that way. All right, I knew I kind of like blew through that only because the information was pretty straightforward, but if you guys have any questions for me, please let me know. I will sit around for a few minutes in the chat to answer any lingering questions or concerns. If you don't have a question right now, if something pops up, again, you all have my number. Please text me, please call me. You can always email mrcsl.gov if you have any pressing questions. And I think that's about it. I'm
There
checking the
was a
chat right now. I'm sorry, go ahead.
question in the chat that I just want to make sure that everyone knows. Someone asked, let me see if I can find the exact message. Someone asked, in the event that there's a hyperthermia, is the temperature that's taken, is it oral, axillary, or rectal? And the typically they would take a rectal temp, but MRC volunteers are not allowed to do that, just because that kind of falls under something that's, you know, invasive under our scope of practice. I mean, I guess maybe a lot of people won't complain that they can't do a rectal temp, but yes, you're not allowed. And then I did post Satori's number. It was, the full number is in the chat. And then Marlon asked how often do we need the stop the bleed training?
So going forward, I actually just won us some money. So we just got an award for about $75,000 for the MRC Rise Awards from everything that we've done from COVID. So again, for all of you, thank you. I was planning on announcing that to everybody later on, but since you're on the call right now, thank you. We did get a bunch of grant funds. So I plan to have a lot more trainings in person going forward. I'm currently working with our training coordinator right now to put everything together in a calendar for you guys so that you can have it, so that you can sign up that way. But ideally, I would preferably like to have at least 2 in-person stop the bleed trainings every year. One typically in the summer months, right before Made in America, and then one in the wintertime. Hopefully next year it'll be before the Philadelphia Marathon. But I do plan on putting 2 stop the bleed trainings on the calendar every year going forward. And then additionally, we're also planning to do CPR, AED training, things like that, first aid. But we got to get the funding sorted out, and you all will be updated with the information as soon as I have more details about that. And I apologize for shorting my number a digit. I don't know how I did that, but I'm glad you guys all have my number now. All right, I'm going to scan the chat one more time to make sure I didn't miss anything.
There was a question from Eric asking, is there a specific dress code for Saturday or Sunday? I would suggest dressing in multiple layers so you can remove as needed. In the morning, it's likely to be extremely cold and it may warm up throughout the day, or it could just stay cold all day. So I would recommend dressing in layers so you can you know, remove as needed. Yeah, and just to build off of that response, unfortunately, we won't have any MRC t-shirts on site for you this time, only because it's a large deployment. There's a lot of moving parts, and with the early arrival time, it's a lot of logistics to bring to the site. But you are not required or asked to wear anything MRC. It is going to be entirely too cold to wear a t-shirt. So please feel free to wear whatever you need. I would recommend hoodies, some thick pants. If you have Uggs, you can wear those. Anything to keep your toes warm. You have hand warmers, bring them. Like I said, hopefully this year is better, but it can get really cold being outside. You may not feel like it, or you may not feel it initially, but you will be out there for a good portion of the day. The medical tent is heated, so you do not have to worry about that. There will be heaters inside to keep you nice and toasty, but again, the tent can kind of become a little crowded. So some people step out. A lot of people like to watch the runners cross the finish line. The tent is located at the finish line, so you will have a little bit of action there, but you aren't required to have any official dress codes. And yes, there will be a spot to put your personal belongings and bags. They're towards the back of the tent. There'll be a designated location for all personnel to kind of leave their stuff. Again, this is a very secure site with EMS and the police department, so there's nothing really to worry about. And there will be specific porta potties for staff, so you're not sharing those with the public. Someone asked, do you have to do a stop the bleed training annually or every 2 years? So it's not currently a requirement. Once we get training set in stone and put in place, I will strongly encourage everyone to do this, because if you are going to be out in the field with us at any of our deployments, it's essential to kind of know this information. You never really know what you're going to see anywhere you go when you're deploying with MRC. It is Philadelphia, so we want to make sure that everyone is prepared.
And even having basic first aid skills such as stop the bleed, it can be essential to save a life. You know, in the off chance, even if you are in your personal life, if you're not volunteering, it's always great information to kind of have. So I do want to make sure that I'm providing this for you guys more readily than it has been in the past. So we're working on that. And again, I will give you guys all that information very, very soon. All right, I'm just going to scan one more time. All right, I don't see any other questions in here, but if any of you guys are curious about any of our trainings, or if you have missed some of our trainings in the past, I'll link our YouTube page for you in the email that I'll send you with the recording of this training and informational session. You're welcome to browse through any of the recent videos that we have posted. All of our trainings and anything virtual that we do will be linked to that MRC YouTube page so that you have continuous access to it. Even if you're not participating in whatever deployment it was geared towards, it'll be there for you as well as a resource. All right, I think that's it. We made it with 3 minutes to spare. Again, I really do appreciate everyone giving your time to us this evening. We really do appreciate it. I know it's not an easy ask on a Tuesday evening. So again, thank you so much. Thank you for all of your volunteerism. I greatly appreciate you. I apologize for bombarding all of you with all of my annoying emails. But again, now you have my telephone number. So if you need to contact me directly, please do so. I'm always here for you as a resource and as an advocate. If there's nothing else, you guys can feel free to enjoy the rest of your evening. For those of you going to the deployment, thank you. Enjoy. Let me know if you need anything. Let Molly know or Cydni know, and I'll send out a feedback survey after your experience to kind of figure out how it went. Okay. Alrighty. Thank you so much. I really appreciate it. Bye, Charito. It's nice seeing you.
Nice seeing you too, guys. I'll see you soon. Bye-bye.
See you soon. Have a great night.
Same to you.
And I'll hang out if anybody needs me for anything. Thank you, Cydni. And thank you, Molly.
Thanks, Satori.
Masks are not required anymore in the medical tent. They are strongly encouraged. This is the winter months. People do get sick, so it is encouraged to wear a mask. I always encourage volunteers to wear masks in the field, but it is not required as of right now.
Hi, Tori. Do you mind if I ask you a question?
Yeah, of course.
Okay, so my name's Sunny. I'm actually a medical student over at Rowan, new to the MRC. Someone, I guess, at our school kind of connected us to your organization.
Yeah.
But I was just wondering if, so I personally didn't get